My story began almost 20 years ago when, after moving to Phoenix, I started seeing a primary care doctor for checkups. I was then in my mid-30s, and my checkups revealed that I had high liver enzymes. Over a decade, my liver enzymes remained elevated, and despite blood tests and multiple liver ultrasounds, I received no diagnosis from my primary care doctor. It was ultimately my dermatologist, who was investigating an unrelated health issue, who referred me to a hepatologist due to persistently high liver enzymes. After further blood tests, ultrasounds, and a liver biopsy, I was diagnosed with fatty liver disease. When I was in my mid-40s, I moved to Oklahoma City, and I was unaware that my liver disease was progressing. A year after the move, I was diagnosed with end-stage liver disease, leaving me in shock. My primary care doctor referred me to a gastroenterologist, but my condition did not improve. Eventually, I was sent to a transplant center for evaluation. I managed to return to work after being told they'd see me again in a year. However, only 6 weeks later, I was in the emergency room, and just 4 months later, I was diagnosed with inoperable liver cancer. I was told I needed a liver transplant to survive. No one should have to hear such devastating news. I underwent a TACE procedure in which chemotherapy is delivered to the blood vessels supplying the tumor to halt the cancer's growth before being eligible for the transplant list. My primary care doctor guided me through this process, displaying expertise in liver disease. The following year, I received my liver transplant. After the liver biopsy following transplant, I learned that I had AATD and that my liver condition was actually Alpha-1 liver disease. The hepatologist didn't seem to be concerned, told me not to worry and to watch what I ate, without implementing any additional lifestyle changes other than watching what I ate. It was like throwing gasoline on a fire that was burning inside me. Because I was unfamiliar with AATD, I researched it. Looking back, there were opportunities and signs that pointed to AATD that weren't picked up. I also realized that my mother, who passed away due to lung complications 12 years ago, had also never been diagnosed with AATD. I thought about all the many tests that both she and I had undergone, but AATD testing was not done, and no link was made between this genetic disease and our symptoms. I feel that there is a limited understanding of Alpha-1 liver disease, since it is a rare disease. So some signs that may point to Alpha-1 liver disease as a potential cause of liver disease may be missed when diagnosis for patients with liver disease is being made. My hope for the future of Alpha-1 liver disease is that all doctors, including hepatologists, gastroenterologists, pulmonologists, primary care physicians, and pathologists, become more knowledgeable about this condition and are better equipped to investigate the root cause of patients' elevated liver enzymes. I hope that AATD testing will become required so that the risk of misdiagnosis of Alpha-1 antitrypsin deficiency can be reduced. It is important to consider the possibility of AATD when evaluating patients with their liver disease symptoms, particularly in those who have a family history of the condition.